How did you get involved in this work?
My background actually is currently community health or a public health focus, so I've always been interested in this work. I've done a lot with other prevention topics as well, including breast cancer, and really just I'm passionate about the proactive approach versus the reactive, whether it's in terms of a disease prevention or substance use prevention.
Tell us about your coalition.
The idea behind our coalition really originated in 2009, just really needing a collaborative approach, but was officially established in 2012 due to the efforts of our local sheriff, Sheriff Joel Brott. We do a lot of drug use prevention in regards to alcohol, marijuana, prescription drugs, and tobacco products in general. We currently are focusing a lot of our efforts really towards alcohol, marijuana, and tobacco products, specifically vaping. We just know how problematic it is in our community, not only from community members, but specifically our youth and our parents and our school representatives are just saying it's a really pronounced issue within the school setting.
What does building community support look like for your coalition?
We're going to need to organize support. So starting with a coalition, starting with another community group that's available, that is passionate about the topic or could potentially be passionate about the topic. You have to really kind of look into that local data and really get to know your community members and local stakeholders that are going to be able to support an initiative. One example that we have within our coalition is looking at a social host ordinance. We know alcohol is the #1 used and abused substance within Sherburne County, Minnesota, and even the nation. So when we start looking at something like a social host ordinance, where it's already illegal to provide alcohol to minors, and this makes it illegal to provide that space. So when we look at that policy, we started saying, okay, we know it's a problem here in Sherburne. How can we address it, and who can help us address it? We started networking with community partners such as our local law enforcement, county attorney's office, youth, and parents, initially to really get that process started. And in turn, we started finding other community groups that maybe weren't as a usual suspect that we'd go to. For instance, our local faith community was very supportive of it and really saw a need for it in one of our communities. One way to partner with your local community members is to even start to look at, in this instance, a city board, seeing if they have some type of workshop option where you can go and just sit down and have an informal discussion about the policy itself. What are the pros? What are the cons of the policy? It's so important to know what the downfalls could be of passing something like this and really addressing the concerns that could prohibit the policy from following through. Starting off with something like a council workshop could actually provide that education needed to gain support for the policy as you move forward. And that's where you might get on that formal city council agenda to actually talk about the policy, and then in turn you'd get the vote on it at the same time.
How do you think sharing this will help others?
I think it makes prevention work less scary and more relatable. This is something that you don't have to be what we like to call a prevention professional to be able to share this information. Really, as someone like myself as a coordinator or a public health professional, I also consider myself a community member. So you're putting yourself into that not only personal, but or not only professional, but a personal role. It's something you care about. Everyone cares about their community, or you care about your youth. And again, it's just something that is relatable regardless of your background.